San Diegans had their second dose of the COVID-19 vaccine appointment pushed back when the county didn't get its shipment of the Moderna vaccines on Friday. So tonight we continue to answer your questions about vaccines in our series, The Rollout. Our ABC 10 News reporter Mimi Alcala spoke with medical professionals about how long it is safe to wait for that second dose.
Scheduling a second COVID-19 vaccine dose continues to be a problem for some San Diegans. Some second dose appointments were even delayed by about a week when a vaccine shortage caused the Petco Park vaccination superstation to close for 3 days. ABC 10 News has heard from viewers worried that they won't get that second dose within the recommended time frame, 21 days after the first dose for Pfizer and 28 days after for Moderna.
Just because you've been delayed, whether it be 8 days or 14 days, etc., does not mean you're not going to respond appropriately. We believe that you can respond appropriately.
Dr. David Pride is the director of molecular microbiology at UCSD Health. He says when you get that first COVID-19 vaccine dose, your body starts working to provide protection.
You're really sort of trying to prime your immune system to start responding, and most importantly, you're trying to create it such that your immune system is going to remember having seen that virus before.
The second dose or booster then ramps up that immune response. Pride says shooting for the 21 or 28 days is definitely preferred, but he says if that's not possible, there is some leeway. The CDC recently updated guidance, which says the second dose should be administered as close to the recommended interval as possible. However, if it is not feasible to adhere to the recommended interval and a delay in vaccination is unavoidable, the second dose of Pfizer, BioNTech, and Moderna COVID-19 vaccines may be administered up to 6 weeks, 42 days after the first dose.
They came up with 42 days based on data and based on studying the population and getting a feel for how the body mounts the immune response. There's not a lot of data out there, but the limited data they have has said if it is not feasible to get the shot at the optimal time, and it's unavoidable, that you have up to 42 days to get that shot from the first dose without compromising your body's immunity.
Marissa Corey is the outpatient pharmacy supervisor at Sharp Chula Vista Medical Center, and she's also been helping with vaccinations at the South Bay Superstation for about 3 weeks. Both Corey and Pride agree people should strive to get the second dose within the original recommended time frame because that has been studied the most. But they say if your appointment is delayed, follow the CDC guidance and get the shot within the 42-day window.
Let me reassure the viewers, if you are delayed in your second dose, whether it be weather, whether it be family problems, do not be concerned. You are still able to mount an immune response.
Mimi Alcala, ABC 10 News.